Ultimate Mental Health Schizophrenia Practice Guide. Question 1. Why is it important to establish a contract with a client with an eating disorder at the beginning of treatment? Option A. The client and healthcare provider form a partnership that is challenging for the family to disrupt. Option B. A collaborative approach to treatment planning ensures that both physical and emotional needs will be addressed. Option C. Involving the client in decision-making enhances the feeling of control and fosters cooperation. Option D. Permission for refeeding is crucial as it can have adverse effects. The correct answer is option C. Involving the client in decision-making enhances the feeling of control and fosters cooperation. Establishing a contract with a client with an eating disorder at the start of treatment is crucial to involve the client in decision-making processes. By engaging the client in decision-making, it enhances their. Question 2. When assessing a patient with generalized anxiety disorder, GAD, which symptom would the nurse most likely observe? Option A. Flashbacks. Option B. Excessive worry. Option C. Hallucinations. Option D. Compulsive behaviors. The correct answer is option B. Excessive worry. Excessive worry is a characteristic feature of generalized anxiety disorder GAD. Patients with GAD experience persistent and excessive worry about various aspects of their life, such as work, health, or family. Question 3. A healthcare provider is providing care for a patient with schizophrenia. Which symptom would be considered a positive symptom of this disorder? Option A. Eulogia. Option B. Andonia. Option C. Delusions. Option D. Flat affect. The correct answer is option C. Delusions. Delusions are considered a positive symptom of schizophrenia. Positive symptoms represent an excess or distortion of normal functions, such as hallucinations, delusions, or disorganized speech or behavior. N. Question 4. Pablo is a homeless adult who has no family connection. Pablo passed out on the street, and emergency medical services took him to the hospital where he expresses a wish to die. The physician recognizes evidence of substance use problems and mental health issues and recommends inpatient treatment for Pablo. What is the rationale for this treatment choice? Select one that doesn't apply. Option A. Intermittent supervision is available in inpatient settings. Option B. He requires stabilization of multiple symptoms. Option C. How do you feel about talking to a mental health counselor? Option D. Medication adherence will be mandated. The correct answer is option D. Medication adherence will be mandated. The correct answer is D because medication adherence being mandated is not a primary rationale for inpatient treatment. The main reasons for recommending inpatient treatment in this scenario include the need for. Question 5. A patient with major depressive disorder is started on a tricyclic antidepressant, TCA. Which common side effect should the nurse educate the patient about? Option A. Hypertension. Option B. Diarrhea. Option C. Dry mouth. Option D. Weight loss. The correct answer is option C. Dry mouth. The correct answer is C. Dry mouth. Dry mouth is a common side effect associated with tricyclic antidepressants TAS. TAS block acetylcholine receptors, leading to anticholinergic effects, such as dry mouth. Question 6. A patient with obsessive-compulsive disorder, OCD, is undergoing treatment with an SSRI. Which SSRI is commonly utilized for this condition? Option A. Fluoxetine. Option B. Citalopram. Option C. Paroxetine. Option D. Escitalopram. The correct answer is option C. Paroxetine. Paroxetine is a selective serotonin reuptake inhibitor SSRI commonly prescribed for obsessive-compulsive disorder due to its efficacy in managing OCD symptoms. While different SSRIs may be used based on individual. Question 7. What principle about patient-nurse communication should guide a nurse's fear of saying the wrong thing to a patient? Option A. Patients tend to appreciate a well-meaning person who conveys genuine acceptance, respect, and concern for their situation. Option B. Patients are more interested in conversing with you than in hearing your perspective, making offense unlikely. Option C. Considering the patient's background, the likelihood of the comment causing harm is minimal. Option D. Individuals with mental illness often possess a heightened capacity for forgiveness. The correct answer is option A. Patients tend to appreciate a well-meaning person who conveys genuine acceptance, respect, and concern for their situation. The correct answer is A. Patients value interactions with healthcare providers who express genuine acceptance, respect, and concern for their well-being. By focusing on conveying these qualities, a nurse can help. Question 8. Tatiana has been hospitalized for an acute manic episode. On admission, the nurse suspects lithium toxicity. What assessment findings would indicate the nurse's suspicion as correct? Option A. Shortness of breath, gastrointestinal distress, chronic cough. Option B, ataxia, severe hypotension, large volume of dilute urine. Option C, gastrointestinal distress, thirst, nystagmus. Option D, electroencephalographic changes, chest pain, dizziness. The correct answer is option B, ataxia, severe hypotension, large volume of dilute urine. The correct answer is B, ataxia, severe hypotension, and a large volume of dilute urine are classic signs of lithium toxicity. Ataxia refers to a lack of muscle coordination, severe hypotension indicates dangerously. Question 9. Which statement made by the patient demonstrates an understanding of the treatment of choice for patients managing the effects of traumatic events? Option A. I attend my therapy sessions regularly. Option B. Those intrusive memories are hidden for a reason and should stay hidden. Option C. Keeping busy is the key to achieving mental health. Option D. I've agreed to move in with my parents so I'll get the support I need. The correct answer is option A. I attend my therapy sessions regularly. Regular attendance at therapy sessions is a crucial aspect of the recommended treatment for managing the effects of traumatic events. Therapy provides a safe space for individuals to process their experiences. Question 10. To provide effective care for the patient diagnosed with schizophrenia, the nurse should frequently assess for which associated condition. Select one that doesn't apply. Option A, alcohol use disorder. Option B, major depressive disorder. Option C, stomach cancer. Option D, polydipsia. The correct answer is option C, stomach cancer. Schizophrenia is often associated with comorbid conditions such as alcohol use disorder, major depressive disorder, polydipsia, and metabolic syndrome. Stomach cancer is not a common associated condition with. Question 11. Which medication is commonly prescribed for the treatment of panic disorder? Option A, haloperidol. Option B, clonazepam. Option C, lithium. Option D, fluoxetine. The correct answer is option B, clonazepam. Clonazepam, a benzodiazepine, is commonly prescribed for the treatment of panic disorder due to its anxiolytic properties. It helps reduce the frequency and intensity of panic attacks by acting on the central nervous. Question 12. Which intervention should the nurse implement when caring for a patient demonstrating manic behavior? Select one that doesn't apply. Option A, monitor the patient's vital signs frequently. Option B, keep the patient distracted with group-oriented activities. Option C, provide the patient with frequent milkshakes and protein drinks. Option D, reduce the volume on the television and dim bright lights in the environment. The correct answer is option B, keep the patient distracted with group-oriented activities. When caring for a patient demonstrating manic behavior, it is crucial to monitor vital signs frequently to ensure the patient's physical health is stable, providing nutrition, such as milkshakes and protein drinks. Question 13. Which therapeutic communication statement might a psychiatric mental health registered nurse use when a patient's nursing diagnosis is altered thought processes? Option A. I know you say you hear voices, but I cannot hear them. Option B. Stop listening to the voices, they are not real. Option C. You say you hear voices, what are they telling you? Option D. Please tell the voices to leave you alone for now. The correct answer is option C. You say you hear voices, what are they telling you? The correct answer is C. You say you hear voices, what are they telling you? Because it employs therapeutic communication techniques that validate the patient's experience while encouraging further. Question 14. A nursing student new to psychiatric mental health nursing asks a peer what resources he can use to identify the symptoms present in a specific psychiatric disorder. The best answer would be Option A, Nursing Interventions Classification, NIC. Option B, Nursing Outcomes Classification, NOC. Option C, NANDI Nursing Diagnoses. Option D, DSM-5. The correct answer is option D, DSM-5. The DSM-5 is the standard classification of mental disorders used by mental health professionals in the U.S. It provides criteria for diagnosing different psychiatric disorders based on symptoms and clinical. Question 15. Which intervention is most appropriate for a patient with a phobia of flying? Option A, exposure therapy. Option B, cognitive restructuring. Option C, medication management. Option D, psychoeducation. The correct answer is option A, exposure therapy. Exposure therapy is considered the most appropriate intervention for a patient with a phobia of flying. This therapeutic approach involves gradually exposing the individual to the feared stimulus, in this case. Question 16. When assessing a patient with major depressive disorder, which symptom would most likely be observed? Option A, euphoria. Option B, anhedonia. Option C, increased energy. Option D, racing thoughts. The correct answer is option B, andonia. Andonia, the inability to feel pleasure in activities that were once enjoyable, is a hallmark symptom of major depressive disorder. Patients with major depressive disorder often experience a pervasive feeling of. Question 17. When attempting to determine a teenager's mental health resilience, what assessment question should the nurse ask that is not applicable? Option A. How did you cope when your father deployed with the army for a year in Iraq? Option B. Who did you go to for advice while your father was away for a year in Iraq? Option C. How do you feel about talking to a mental health counselor? Option D. Why would you think that is a better option than meeting with me? The correct answer is option D. Why would you think that is a better option than meeting with me? Assessing a teenager's mental health resilience involves exploring coping mechanisms, support systems, and attitudes towards seeking help. Option D is not relevant to assessing resilience but rather focuses on the. Question 18. A patient with bipolar disorder has been prescribed lithium. Which dietary advice is important for the nurse to include? Option A. Avoid foods high in tyramine. Option B. Maintain a consistent salt intake. Option C. Increase protein intake. Option D. Avoid foods high in fat. The correct answer is option B. Maintain a consistent salt intake. Patients prescribed lithium should maintain a consistent salt intake to prevent fluctuations in lithium levels. Salt intake can impact lithium levels, and sudden changes in salt intake can affect how the body absorbs. Question 19. Gilbert, age 19, is described by his parents as a moody child with an onset of odd behavior at age 14, which caused Gilbert to suffer academically and socially. Gilbert has lost the ability to complete household chores, is reluctant to leave the house, and is obsessed with the locks on the windows and doors. Due to Gilbert's early and slow onset of what is now recognized as schizophrenia, his prognosis is considered. Option A. Favorable with medication. Option B. In the relapse stage. Option C. Improvable with psychosocial interventions. Option D. To have a less positive outcome. The correct answer is option D. To have a less positive outcome. The scenario describes Gilbert as having an early and slow onset of schizophrenia, which typically indicates a less positive prognosis. Individuals with such presentations may experience more severe symptoms and. Question 20. Which of the following therapies is considered the most effective for treating phobias? Option A. Cognitive behavioral therapy. Option B. Psychoanalysis. Option C. Medication management. Option D. Group therapy. The correct answer is option A. Cognitive behavioral therapy. Cognitive behavioral therapy (CBT) is widely recognized as the most effective treatment for phobias. CBT helps individuals identify and change negative thought patterns and behaviors associated with their phobias. Question 21. Child Protective Services have removed 10-year-old Christopher from his parents' home due to neglect. Christopher reveals to the nurse that he considers the woman next door his nice mom, that he loves school, and gets above-average grades. The strongest explanation of this response is Option A. Temperament. Option B. Genetic factors. Option C. Resilience. Option D. Paradoxical effects of neglect. The correct answer is option C. Resilience. Christopher's positive outlook, strong school performance, and forming a bond with the neighbor indicate resilience. Resilience refers to the ability to adapt and thrive despite facing adversity, such as being. Question 22. Tammy, a 28-year-old with major depressive disorder and bulimia nervosa, is ready for discharge from the county hospital after 2 weeks of inpatient therapy. Tammy is taking citalopram, Celexa, and reports that it has made her feel more hopeful. With a secondary diagnosis of bulimia nervosa, what is an alternative antidepressant to consider? Option A. Fluoxetine, Prozac. Option B. Isocarboxazid, Marplan. Option C. Amitriptyline. Option D. Duloxetine, Cymbalta. The correct answer is option A. Fluoxetine, Prozac. Fluoxetine Prozac is a suitable alternative antidepressant for Tammy due to its approval for the treatment of bulimia nervosa. It belongs to the selective serotonin reuptake inhibitor SSRI class of. Question 23. A patient with agoraphobia is unable to leave home. Which intervention should the nurse prioritize? Option A. Teach the patient relaxation techniques. Option B. Gradual exposure to feared situations. Option C. Encourage the patient to attend social gatherings. Option D. Provide education about the disorder. The correct answer is option B. Gradual exposure to feared situations. For a patient with agoraphobia, the priority intervention should be gradual exposure to feared situations. This approach helps the patient confront and gradually overcome their fear of leaving home. Question 24. An individual who has survived incest and is receiving treatment at the mental health clinic feels relief upon understanding that her anxiety and depression are option A, going to be eradicated with treatment, option B, normal and will soon pass, option C, abnormal but will pass, option D, a normal reaction to post-traumatic events. The correct answer is option D, a normal reaction to post-traumatic events. It is important to recognize that anxiety and depression are common responses to traumatic events like incest. Understanding that these feelings are normal reactions can help validate the individual's experiences and. Question 25. Tomasz is a 21-year-old male with a recent diagnosis of schizophrenia. Tomasz's nurse recognizes that self-medicating with excessive alcohol is common in this disease and can co-occur along with option A, generally good health despite the mental illness, option B, an aversion to drinking fluids, option C, anxiety and depression, option D, the ability to express his needs. The correct answer is option C, anxiety and depression. Individuals with schizophrenia often turn to excessive alcohol consumption as a way to manage symptoms of anxiety and depression. This maladaptive coping mechanism can exacerbate the challenges associated with